Hello, my name is Bradley Hoover, and I just wanted to share this presentation about Ehlers-Danlos Syndrome, the hypermobility type. I did a little bit of research and critically appraised the evidence to see if balance exercises were effective or indicated for this particular diagnosis. So, a little bit about Ehlers-Danlos Syndrome, hypermobility type. It's one of the most common heritable genetic disorders. It affects the connective tissue and it causes hypermobility, activity related pain, joint instability, muscle weakness, and poor balance, which is why I wanted to see if balance exercises would be indicated. Children with HEDS, according to the British Society of Pediatric and Adolescent Rheumatology, suggest that a lifelong commitment to exercise is needed, and physical therapists are the profession probably the most suited for promoting exercises in young patients, which is why it's important that kids with HEDS go to physical therapy or see a physical therapist. So, upon appraising the research, I've only found two randomized controlled trials, and they both suggested that strength exercises may reduce pain associated with HEDS, but it's really lacking in evidence right now. So, Kemp Roberts Gamble et al. Study compared targeted physical therapy to generalized, two groups over a 6-week period of time. And what they found from their study was whether you were generalizing strength exercises or targeting it to a specific area on the patient, that it both showed a reduction in pain. The Pacey's, Toft, Adam, Munns, and Nicholson study checked the knee joint strength and control to see if it was an effective way of reducing knee pain. They also compared whether training into the hypermobility range allowed by these patients with their hypermobile knees was better than training to neutral. The results showed, similar to the other studies, that strengthening the painful symptomatic joint helped improve strength and reduce pain, but the comparison between hypermobile training to neutral training, there was not a significant difference. So according to the BSPAR, physical therapy is the most effective way was most effective when it's targeting a specific area of difficulty in a patient. So if your patient has a hypermobile ankle and problem balancing because of that, strengthening the ankle joint seems to be the most effective way. Again, common impairments for hypermobility, Ehlers-Danlos Syndrome, is joint hypermobility, activity-related pain, joint instability, muscle weakness, and poor balance. Physical therapists are trained to identify impairments and to treat them to the best of their clinical knowledge. So, because the evidence is weak, it doesn't necessarily mean physical therapy can't help kids with Ehlers-Danlos Syndrome, the hypermobility type. What it means is that you would probably want to seek a physical therapist in order to identify impairments that your child is having, and the physical therapist has the ability to identify those impairments and treat them in an effective way. And here are the references.